Fistulas by Ago. Key terms: abscess, a collection of pus surrounded by inflamed and infected tissue. Description: fistulas can rise in any part of the body, but they are most common in the digestive tract. They can also develop between blood vessels and urinary, reproductive, and lymphatic systems. Diabetics, individuals with compromised immune system, and individuals with certain gastrointestinal diseases are increased at risk of developing fistulas. Fistulas are categorized by the number of openings they have and whether they connect to internal organs or open through the skin. One of the most common fistulas is the fistulas of the digestive tract. Anal and rectal fistulas develop in the wall of the anus and rectum. They connect interior of the body to one of the several openings in the skin. Anal and rectal fistulas almost always begin as an inflammation in the anal gland. The inflammation then moves into the muscle tissue and develops into abscess. In about half of the cases, the abscess develops into fistulas, degrading the muscle until the opening into the skin is created. Men are almost twice more likely to develop the condition than women. Intestinal fistulas can develop in both large and small intestine. They are commonly associated with disease such as inflammatory bowel disease and Crohn's disease. Tracheoesophageal fistulas are usually birth defects. The windpipe of the trachea is abnormally connected to the esophagus. This allows air to enter in the digestive system and makes it possible to breathe food into the lungs. Aspiration. In many cases, the esophagus is also incomplete, causing immediate feeding problems. There are several types of tracheoesophageal fistulas, categorized by where the fistula is located and how the esophagus and trachea are connected, but they all are life-threatening situation and require prompt surgery to repair. This is one of the pictures of the anal and rectal fistulas. Fistulas of the urinary and reproductive tract. The most common type of fistulas involving these systems is the vesicovaginal fistula, in which the woman's vagina is connected to the urinary bladder. This causes leakage urine from the vagina to results in frequent vaginal bladder infection. Fistulas may also develop between the vagina and the large intestine. Enterovaginal fistula. So the feces leaks from the vagina. They are common in poor developing countries and result from long, difficult labor and childbirth, especially in very young girls. As a result, they are sometimes referred to as obstetric fistulas. If left unrepaired, obstetric fistulas cause women to constantly leak urine and feces. As a result, they become socially outcast, causing them extreme hardship and psychological trauma. There is a picture of the urinary and reproductive tract fistulas. Fistulas of the circulatory system. Arteriovenous fistulas can develop between an artery and a vein in any part of the body. These fistulas vary in size, length, and frequency. Arteries contain blood carrying oxygen to all parts of the body, while veins carry blood that has given up this oxygen back to the lungs. Connections between arteries and veins changes in the blood pressure that result in an abnormal development of the wall of the arteries and abnormal blood flow. Arteriovenous fistulas that are present at birth are sometimes referred to as arteriovenous malformations. Many arteriovenous fistulas are present but not evident at birth. It becomes obvious only after trauma. Arteriovenous fistulas can also be acquired from penetrating trauma. Causes and symptoms. The causes and symptoms of the fistulas vary depending to their location. Anal and rectal fistulas are usually caused by an abscess. Symptoms include constant throbbing pain and swelling in the rectal area. Pus is sometimes visible draining from the fistula opening on the skin. Many individuals have fever resulting from infection caused by the abscess. Vaginal fistulas are caused by infection and trauma to the tissue during childbirth. They are easily detected because the woman smells unpleasant and leaks urine and feces through her vagina. Rarely, these fistulas might develop as a complication of the hysterectomy. Tracheus- Tracheoesophageal fistulas are full of errors that determine the fetus. They are evident at birth because the infant is unable to swallow or eat normally and are considered a medical emergency that requires surgery if the infant is to survive. Arteriovenous fistulas are most often congenital defects, symptoms that might depend on the size and location of the fistulas. Often the skin is bright, pink, or dark red in the area of the fistulas. Individuals might complain of pain. The pain is a result of some tissues not receiving enough oxygen because of the normal blood flow. Diagnosis. Tests used to determine the presence of fistulas vary with the location of the fistula. When there is an opening to the outside, the physician might be able to see the fistula and improve it. Various imaging studies such as X-rays, CT scans, barium enemas, endoscopies, and ultrasonography are used to locate less visible fistulas. Treatment. Anal and rectal fistulas are treated by draining the pus into the infected area from the infected area. The individual also is usually given antibiotics to help to prevent recurrence of the abscess. If this fails to heal the fistula, surgery might be necessary. Fistulectomy is an incision of the entire fistula tract. Gas packing is inserted and wound is allowed to heal by granulation. Injection of fibrin glue might be used to seal the fistula. Intestinal fistula are treated first by reducing the inflammation in the intestine and then, if necessary, with surgery. Treatment varies considerably depending on the degree of severity of the symptoms of the fistula causes. Tracheoesophageal fistulas are always treated with surgery. Obstetric fistulas must also be repaired with surgery. The treatment of arteriovenous fistulas depends on the size and location of the fistulas and usually includes surgery.